This is my transcultural nursing presentation, Improving Cultural Competency to Decrease Barriers to Healthcare for American Indians. I'm your narrator, Barbara Doyle Barrett. Today is April 26, 2015. Improving cultural competency is a necessary part of improving healthcare for all populations, including the American Indians. Improving communication and understanding will help reduce barriers for all cultures. As nurses, our role is to provide evidence-based information or evidence-based practice so our patients can make informed decisions for the health care across the lifespan. To meet this goal, we must not only include the patient in their health care and their plan of care, but we must also be willing to incorporate their native practices or alternative forms of methods. The following statistics are from the North Carolina Department of Public Health, U.S. Census 2000. 131,736 North Carolina residents, which equates to 1.6% of the state's population, are identified as American Alaskan Native. 99,541 are identified as American Indian or Alaskan Native alone. In North Carolina, we have 8 individual tribes and 4 different organizations that support this community. The median age of an American Indian or American Native is 30 years, whereas the North Carolina population is 35 years old. These are some of the cultural differences by comparison that is compiled by the North Carolina Department of Public Health. You can see Indian values versus non-Indian values. Their lifestyle is cooperation, group emphasis, passive, informal courtesy. Religion is a way of life for them, which is something that was a little bit different that I've been reading. Nonverbal, extended family, and holistic problem solving. Non-Indian values, which we can compare to some of us, we think about competition, more on the individual. We are more assertive. We're more polite, or formally polite. Religion is a segment of our life, as opposed to religion is a way of life for the Indians. We are more verbal. We have a nucleus family, and analytical problem solving. With Indians, with their extended family, that can be blood relatives, aunts, uncles, cousins, anybody that they deem as family is part of their family. Providing culturally sensitive nursing care across the lifespan. The first topic we're going to talk about is childbearing women. I think the best thing we can do is provide them with education and inform them of available services and the importance of prenatal care. Some of the statistics that I have from NC Public Health about American Indian childbearing women, they're more likely to begin prenatal care after their first trimester. And we all know that first trimester is key in having a healthy, happy baby. They also have highest rates of smoking during pregnancy. This was a fact I was not aware of. They have the second highest infant mortality rate. They also have the highest rate of birth defects. I think those two things come in combination with not getting the prenatal care that they need in the first trimester. Another important fact is American Indian teens in North Carolina has a pregnancy rate 53% higher than the average rate for white teenage American girls. So all these things would help if we had more education and more information available for them to make decisions. The next group we're talking about in the lifespan is children. I think what we can do with children is provide education for the family and of all the available services with public health, community health clinics, as far as getting their shots, preventative care. All these things are available. And if we can start with children, teaching them healthy lifestyles, I think that'll help through their years when they're growing up. Another fact that I find alarming is American Indian children had the highest death rate of the 3 racial groups, and that was white, black, and American Indian. As far as adults, we can provide information and services. Communication and respect for their culture is key. The health issues you can see on this slide for our Indians are like with the rest of the population we serve here in our rural eastern North Carolina area. 28% have heart disease, 19% with cancer, 5 with diabetes, and 5 with stroke. These are alarming statistics, one that we need to be aware of. Another culture across the lifespan is older adults. I think a lot of them are not aware of the services because they have not been informed about them all through these years. They're more distrusting of these practices because Obviously, we don't have a very good track record. We need to be respectful of their ways and their practices, ask their input, and be open to alternative forms of medicine. It's the same way with the older patients that come into the clinic. They take more time, might not understand, and they need more information to make an informed decision. Some of the alternate ways of healing that the American Indians use that I read about from the Flowers document is they use purification as a way of healing. That means maintaining harmony with nature to cleanse the body and spirit. And that was going into detail about some sweat lodges. Artifacts, they'll carry shells, eagle feathers, bones, beadwork, all these things they take with them because they think that they are powerful medicine. Another thing is the medicine bags. That could be something that somebody has given them or something specifically from a medicine man. One of the articles was talking about if you do have to take this into a surgical operating room, just put it on a sterile field because it's very important for the patient's healing to know that his form of medicine and healing is close by. Communities. American Indians have a strong sense of community and family. Family is not only the blood relations like I talked about earlier, but also the adoptions of aunts, uncles, cousins, grandparents. I think one way we can improve these relationships is to attend functions. A couple of weeks ago I met with the friends of ours that work in one of the clinics, and she gave me a lot of information about the powwow and the dance and the symbols that they have. These are open to the public. You can attend these, and they'll let you know at the beginning if some things they'll be private just for the Indians or they can be open to the public. Everyone I talked to that day when I went to the tribal grounds was very open, very willing to answer any questions that I have, and whatever we needed, they were willing to help. I think another big thing we can do with our patients is form teams to discuss the issues and concerns and integrate their practices and beliefs. It's not easy. It's better to get somebody to be compliant with their health care if they're a part of setting up the plans and goals for their health care. Cultural competency does not require the nurse to be an expert on other cultures or social groups. Instead, it requires sensitivity to diverse cultures by demonstrating cultural awareness, knowledge, and respect. Awareness begins with acknowledging that healthcare has its own deeply held beliefs and practices. This was in the article that I read by Ms. Leonard. It was very informative. Communication key points from Ms. Flowers. Nonverbal communication. American Indians are very comfortable with periods of silence. Listening skills are very important. We need to allow them time for response when we ask them a question. Sometimes they want to think about it before they respond. They don't like us talking in loud voices. Do not make direct eye contact. I think that is long, direct contact. Importance of personal space. They don't want anybody in their personal space unless somebody that is very close to them. One thing that I found very important in reading was understanding the difference between the test is positive as the test is negative. The test is positive. If that is positive for cancer, that's not necessarily good, so we need to make sure that we understand and explain to them that when we're saying the test is positive, they could be taking that literally. So we need to be very clear on our instructions. And with the patients that are in pain that come into the clinics and the hospital and the emergency rooms, pay special attention for nonverbal gestures of pain. In summary, nurses can be the needed connection between American Indian culture, or any culture for that matter, and providing health care to this patient population. 2 key points from Barbara Leonard in her article, Quality Nursing Care Celebrates Diversity, from the Online Journals of Nursing. The increase in cultural diversity in the United States today is reflected in an increase in diversity in healthcare practices, both among persons from diverse cultures and among the general population. The challenge for the nurse is to become knowledgeable about diverse cultures and to bring about greater cultural sensitivity and competency while working within the healthcare system. Nurses can be crucial players in bringing about change at the healthcare system level. System change will take time, persistence, and patience, but cultural competency at the system level will result in improved healthcare outcomes and greater satisfaction for patients and providers. And these are my references. Thank you for your time.